I'm here with my doctor, Carol, who helped to do my, or not helped to do, he did my bariatric surgery. And I just want to know a little bit about you and your background and a little bit more about this process just for everyday people.
Um, I have been in surgery for many years. I started out in 1988, did my residency, Brookdale Hospital. So I've been in in the Brooklyn community for the last, 33 years.
Mm.
I specialize in my specialty is general surgery, but I also have an emphasis in minimally invasive, what we call laparoscopic surgery, with also a special interest in bariatric surgery.
Okay. And what made you specialize in bariatric surgery?
I was fortunate to get into surgery before there was laparoscopic surgery. And you might be a little younger than me, but for those of us who grew up in the college community back in the 80s, we played video games. Back then was Pac-Man. And I was very good at Pac-Man, video games. And when we got into surgery residency and they introduced this new thing called laparoscopic surgery, I just connected with it. It really is about eye-hand coordination. And so I was able to take my training and move into more complex surgery beyond things like gallbladders and appendix and get into high-level GI and then later on bariatric surgery.
Okay. And so during my surgery, I got to meet a lot of the people who works with you. And one thing I noticed was there's a lot of respect for you. And so that's when I kind of learned that you kind of have a bit of a status. You're chief of?
Yes, I'm the chairman of surgery at Harlem Hospital.
Okay.
But I have to let you know, I also was chairman of surgery at the Brooklyn Hospital where you had your surgery. And I was there for 7 years as the chair. So I'm well known in that hospital. I come now in a different capacity, but all of us have a legacy. And as they say, your work speaks for itself. And so that community, they're very respectful and welcoming to me. I come and I do my cases. They take extremely good care of our patients. I started the bariatric program there in 2004, and it's a center of excellence. And so it's a place that I'm proud of to still be associated, even though I'm no longer like working there as I did in the previous capacity.
Okay. But I know, before I even went into surgery, the nurses there was like, how did you get Dr. Carryl? He's excellent. He's excellent. And then your other staff come in and they're like, oh, no, he's great. He's great. So yeah. It's nice to see that. But what I also noticed, I've had other surgeries in the past, and you can kind of tell a doctor's reputation by the people who are the surgery staff around them, because when you're more well respected, you notice that you get checked up on better.
Yes.
And they make sure that you're okay. And so that was kind of the treatment that I got, and I felt that I got that because of you.
Thank you. Thank you very much.
I appreciate you, and I appreciate what it is that you're doing in the community, because it obviously makes a difference. And I know when you're average, people don't really treat you like that. They're just like, yeah, okay, that's Dr. So-and-so's patient, and they just,
I agree with you, and that's something that matters to me. In my legacy, I've been a chairman of surgery in 3 separate hospitals. I started at Brooklyn. I also spent 7 years as a chair at Wyckoff, and now I'm at Harlem as the chair. What I really focus on is excellence. It's important to not just be a Black African-American professional, but to be associated with excellence as a Black person. So to me, that's is a 1-2 combination. I must be good at what I do.
Absolutely.
It's not to say, I want a Black surgeon, but he's not good.
Right.
I want a Black surgeon, but he should be competent and very skilled.
Absolutely. I agree with that. So I know that you did the sleeve. Could you tell people what the bariatric sleeve is and the difference between that and the gastric bypass?
I think that question is one that most people need to know and understand when they walk in for what we call bariatric or weight loss surgery. In all fairness, the gastric bypass has been around, whether it's a combination of an open procedure or done laparoscopically, for about I would say more than 60, 70 years. It's been around for a long time if you combine the open and the laparoscopic. It's really, in many long-term studies, is the best, most effective way to lose weight by surgery. However, as you know in life, one size don't fit everyone, and so you need to have a second option, which is what is called the sleeve. The sleeve is less complicated. The weight loss is slightly less, but it gives you, in terms of the amount of weight loss you're trying to lose, a slower process. There's not a lot of sometimes the loose skin that you would have. So it's a surgery that is really designed to take your stomach and the original size, it's now trimmed down to the size of a banana. And so you have a banana shaped stomach.
Okay. All right. And about how much weight does a person lose on
that? The sleeve is a tool. And the truth of the matter is you could lose any amount of weight you want to on a sleeve. You have gotten the tool already. And like any tool, if you're an effective user, you could actually lose as much weight as you choose to maintain your health. Most people, I would say, if you took a large series, they would probably lose about 65% of the excess weight they have just by the surgery alone. Because what I have done to you, in particular within the first year, I have now set a new maximum that you could eat. And so it's not much you could do to overcome it, except you just want to go beyond your limit, which would mean you'll end up being you'll have nausea and vomiting. And most people don't just keep going and subject themselves to that. So I would say 60%, 65% of excess is a reasonable goal.
Okay. And what do people, like, I know there's restrictions after you have it. So what are some of the very strict food type of restrictions you need to have?
The first week is critical. First week you're on liquid diet. You should not be trying anything more than broth, tea, even some Jell-O is appropriate, but there's a list of things we deem liquids. And the main reason is this. Your stomach has gone through literally a reduction to a third of its size. It has a full longitudinal staple line. And that means your stomach has no business trying to grind food and crush food. So we're looking in the first week for just light stuff to go in almost by gravity. After the first week, you have to be on a puree diet for a month. Again, puree means the consistency of baby food or applesauce. I don't care what you put. If you took the food you made for your family, put it in the blender, season it how you like it, as long as it's like baby food or applesauce, I'm comfortable. Again, the stomach shouldn't have to work to help in the digestion. Other than the first few weeks of pure liquid and puree, I think the main addition is really the ability or the requirement of taking vitamins, because some of the changes do result in some nutritional issues, and so you want to make sure that you have adequate vitamin intake. For most things some of them are conditional, but the ones that are really absolute, I think, fall into that category.
Okay. But you can't eat sugar, right? You can't have sugar and carbonated drinks like sodas and stuff like that.
In general, no.
Okay.
Yeah.
All right. And what do people usually need to do to like for them to be on the path of the weight loss that they want? Like, what do you see they do that, like the type of people who are successful with this and lose the amount that they want and maintain that weight? What is it about them, or what do they do to be successful?
The most important variable, because after doing this for 22 years, I have learned over the time there's some factors. If it's present, there's success. The first one, once you're following the present path, for the next 6 months, you will be losing weight for the most part just by virtue of the surgery that was done. What could you do to support it? Most common thing you could add to the surgery is not necessarily going to the gym. If you could, I mean, that's a good thing. Just walking. And you should walk with an intention to know how many steps you made. Don't just say, well, I do a lot of walking. I prefer you to say to me, doc, I walk X number of steps per day, which allows you to always use it as a baseline to target how you're going to get better, how you're going to be more active. Because a combination of the surgery plus modest activity is really going to be a good thing for weight loss in the near term. But the absolute one thing that I make people put their hands and swear to is that you should follow up. People who follow up usually do well. People who fail to follow up, they fail. And the reason is your brain was designed to protect you, give you some guards. So even if you have a plan to do something and you did something that was irresponsible, which we all might do from time to time, the fact that you are coming to see me in a few months will actually, rein you in. And so we actually have a name for it. We call it the sayonara syndrome. People who come in, get what they need, and then they just stop coming. So I think if you combine the immediate things with long-term follow-up, that's when you see success.
Okay. All right. And is there any particular advice that you would have for people who are considering this surgery? Like, what should they do? Because like why I wanted to do this was because I felt like it's kind of a lonely process, and then it feels a little embarrassing because you're like, oh, I have to do this instead of having the willpower to lose the weight on my own. Like, what advice or what would you say, knowing that this is your profession and you've probably seen hundreds of people, what would you give them as advice?
You're putting me on to the side of this practice that really is the essence of connecting with people. To answer you, I always say to people, to qualify for bariatric surgery, you would have had to try diet, exercise. Some people try pills, some people try hypnosis, and they fail. And of these 5 methods, surgery is by far the most successful. So when you start thinking of surgery, don't think of it as something like you're defeated. I understand you have a need to say, I tried something, and that's really a good thing. But by the time you get to me, I understand you. I get it. Most people don't just come and volunteer for bariatric surgery. They would have tried some legitimate, you don't have to try all of them, but you may have tried to lose weight by exercise and diet. You may have lost 50 or 60 pounds, and it comes back to you gain back 70 pounds. We understand that. That's what we're dealing with. So I'm just trying to tell people out there, people who do weight loss surgery, we understand you. So the first thing you'll find when you come in, whatever the story is, you're not going to be judged. We understand the challenges. We understand sometimes that the biggest challenge might come from the people closest to you who don't understand your struggle. And they're thinking, why don't you just stop eating? Well, we know it's not that simple. Otherwise, we'll all be superstars. So coming into this environment means, first of all, you're coming in to a place where we understand you, we get it. Secondly, I'll be the biggest cheerleader. My patients will tell consistently, I'm pulling for you because I don't want to see you go through this process to fail. I don't want to see you a few years later defeated. So here my message. Come on in. I will do the best job at educating you about the whole process. So when you walk out of here, you will not just have the knowledge about the process, but you will feel that you have the kind of support system, and that's what we try to do. Our office provide support between myself, all my staff. We really understand the special nature of bariatric and weight loss surgery.
And I think that's really important, and something that people need to understand and hear. And I thank you so much for everything that you've done, for being my doctor, being a great doctor.
Thank
you. People should know Dr. Stephen Carryl is who you should contact. If you're really considering this weight loss surgery, it was a good experience, and I'm feeling much better. And this is just 1 week post operation.